Hello, everybody. I'm here and I'm ready to teach. Are you ready to learn? So let's start. So let me share my screen. We're going to learn about cardiac glucosides today, also known as digoxin. Okay, we are ready to go. So if you haven't been with me very long, I'm all about learning the class and then learning about the drug itself. So cardiac glucosides, or DIG, the action is to increase the force of the heart's contraction, and it does that also by slowing the heart rate. It's making the heart work smarter. So think about it. We use digoxin mainly for patients that have heart failure and their heart isn't pumping correctly. That's why the fluid builds up either in the lungs, depending on if it's left-sided, or if it builds up in the body, which is right-sided, okay? So if the heart's not pumping correctly and there's fluid buildup, an increased force of that contraction is going to push the blood further and push the fluids back to the heart better. Slowing the heart down gives it a chance for the ventricles and the atrium to fill before it pushes it out again. So it's pushing out more blood with the slowed heart rate. All good stuff. Okay, uses for this drug are heart failure, cardiogenic shock, and atrial flutter. And I just said heart failure is when the heart or the pump of the circulatory system is not working properly and the blood is not propelled far out of the heart. So the blood pools. That causes the congestion in the lungs and the peripheral edema, or if they're in bed with their feet up, the sacral edema. So effect of digoxin, it will decrease the edema, it will decrease the lung congestion, and it decreases their dyspnea. And it's all because of that increased contraction, force of the contraction, and the slowing of the heart. Side effects would be the GI disturbances of anorexia, nausea, vomiting, diarrhea, bradycardia, and then the visual disturbances of diplopia, blurred vision, yellow vision, or halos, and then headache, fatigue, and drowsiness. So, all right, we're going to stop for a minute. I'm going to go back and I'm going to talk about which ones of these would show toxicity. And the first one would be those GI disturbances, the anorexia, the nausea, the vomiting. The visual disturbances is also a sign of toxicity. And then the bradycardia, if it goes less than 60, remember we hold this drug if it goes less than 60. That is a sign that they've had too much. The therapeutic range for digoxin is 0.5 to 2, and it's the only one of the labs that I have found that we need to know that is in nanograms, okay? There are 3 electrolytes that affect the heart mainly, and it's the heart's ability to function, okay? They are calcium, potassium, and magnesium. The ones that affect the electrolyte disturbances specifically that affect its function are hypercalcemia, hypokalemia, and hypomagnesemia. Now there is others, but those are the 3 biggies. Hypothyroidism affects metabolism and then would definitely affect its ability to function, okay? Now, we're talking drug function here. We're not talking heart function, drug function. These are the ones that would cause toxicity of the digoxin. You with me? Hope so. Okay, so toxicity, I already kind of went over this. Anorexia, nausea, vomiting, visual disturbances, blurred or yellow vision, dysrhythmias, and a pulse less than 60. Kind of repeating what I said, but I've always learned that it's better to repeat it, and you hear it 2 or 3 times, and sometimes it sinks in. Okay, contraindications. Due to the drug slowing the heart with the electrical impulse, clients with ventricular dysrhythmias and second and third degree heart block would not want to use these drugs. Renal disease would slow the excretion of the drug and could cause toxicity. So we would use it with caution with them. Same with hypothyroidism. And then potassium, because it also tends to throw these patients, if they're on DIG, if it's hypo, it tends to throw them into the toxicity. Okay, so nursing interventions. Number 1 is we monitor for toxicity. And I will tell you that the older population are the ones that are going to easily go into toxicity. That's why we see a change in their dosing. Most patients take 1 DIG tablet a day, but some of the elderly, because their kidneys aren't functioning as well, actually take it every other day, going 48 hours, because that keeps them from going toxic. Then we need to monitor the serum digoxin level, and then we need to monitor the potassium level and monitor it for going low, below the 3.5, and notify the MD if it does. Also monitor the potassium wasting diuretics or corticosteroids for use. I can tell you that they tend to use formaldehyde, which is a potassium wasting, a loop diuretic with DIG. So you have to monitor closer when they're on both. More nursing interventions. We need to encourage the client to consume high potassium foods, monitor their apical heart rate for 1 minute prior to giving the med, teach the client how to take a pulse and notify the MD if lower than 60 beats per minute. And of course, the antidote. We always have to know the antidote for these drugs. It's Digoxin immune fab and is used for extreme toxicity. As always, this is brought to you by 101 NCLEX Tutoring. We are here for your nursing student needs, whether it be before school with the T's, during school with classes, or after school with the NCLEX. We are here for you. So, as always, have a good day. See you soon. Bye-bye.